What's up, everybody? Your head and neck exams are graded, and the scores are now on Blackboard. If you have not seen your score, please take a minute to head over to Grade Center and check it out. I want to take a moment just to go over the exam. The grades ranged from 76 to 95. The class average was 89, and the exam ended up being graded out of 122 possible points. After grading everybody's exam, I did decide to make a couple of updates, and I want to go over the updates with all of you now. First, I eliminated questions 29 and 30 from everybody's exam. 29 was asking which is the most likely total dose range for a T2 head and neck irradiation course. Question 30 asked which is the most likely total dose range for a T3 or T4 head and neck irradiation course. Originally, I eliminated these from the final version of the exam. Somehow they snuck their way back in. So these two questions were removed from the exam. Regardless of whether you got them right or wrong, it did not impact your score. I also decided to update question 49. 49 asked, during pre-simulation planning, all of the following are questions to ask the doctor except. Most of you put either D or E, and after looking at this question, I think there's a good argument to make either of these correct. E would be more applicable to CT simulation, whereas D seems applicable for a conventional sim. If we were treating the patient with a conventional three-field technique, it would be important to ask the doctor where the blocking will be placed. And so if you put D or E for question 49, which was all of you, you got credit for the question. And finally, question 82 was updated. Question 82 asked you to define Lhermitte sign, trismus, candidiasis, alopecia, otitis media, and dysphagia. The only one of these terms that I don't think we went over that didn't appear in the PowerPoint was trismus. So if you got trismus, which is lockjaw, correct, you got 1 point of extra credit on the exam. Lhermitte sign appeared in the PowerPoint. It's the sensation of electrical shocks traveling down the neck or the spine. You were required to answer all of these correctly except for trismus. A lot of you also got otitis media wrong. Otitis media is an ear infection or inflammation of the middle ear. Now I want to go through some common mistakes that you guys made so that when you review for the final, you don't make the same mistakes that you made on this exam. Outside of the 3 updated questions, there were not any questions that many of you struggled with. So these are questions that just a few of you missed or only one of you might have missed. Question 4 was a true-false question that said, carcinoma of the larynx is the most common cancer of the head and neck. This is true. Next, question 9, a true-false question that said the supraclavicular and lower cervical nodes do not need to be treated for patients with disease of the nasopharynx. This question was false. And finally, question 14 asked, true-false, patients should have a dental exam before starting radiation therapy to know which teeth are carious and will need to be removed after treatment is complete. This is false. Patients are advised to have carious teeth removed before treatment to reduce the risk of osteoradionecrosis. Question 15 was a multiple choice question that asked, what type of head and neck cancers have the highest incidence of nodal spread? The answer was C, nasopharynx. Question 20 was another multiple choice question, and it asked you, blank percentage of patients with nasopharyngeal cancer present with positive cervical nodes, and blank percent will have bilateral nodal disease. The correct answer was E. 80 to 90% of patients with nasopharyngeal cancer present with positive cervical nodes, and 50% will have bilateral nodal disease. Question 21 said there is no correlation between the size of a primary tumor and degree of lymph node involvement or rate of metastasis for. The correct answer was E, nasopharynx. Question 22, another multiple choice question, said cancer of the lip can be treated with. Your options were photons with a shield for the gums, superficial x-rays, electrons, brachytherapy, or all of the above. The correct answer was E, all of the above. Question 23 said, in hypopharynx patients that are being treated post-op with a separate AP field for supraclav nodes, The spinal cord block should be placed in the blank so that the blank may receive an adequate dose. The correct answer was D. The spinal cord block should be placed in the lateral field so that the stoma may receive an adequate dose. Question 25 asked, the parotid bed can be treated through. The correct answer was D, which was all of the above. The parotid bed can be treated through oblique paired wedged fields, mixed beams from laterals, and IMRT techniques. Question 27 said, the primary anatomical structure is located in the supraclavicular field are. The correct answer was A, which was lungs, clavicles, and nodes. Surprisingly, a lot of you put B, which was lungs, nodes, and heart. Just want to point out that we do not design the supraclav field to include the heart. We want to exclude the heart. Question 45 said, in the treatment of head and neck cancer, immobilization is particularly important because. The correct answer for 45 was C, which is the proximity of several radiosensitive organs and often small tumor margins. Some of you put B, that fields are often very large and could include radiosensitive organs. Large fields certainly include radiosensitive organs, but if you think about it, take a 4-field box for example. When treating a whole pelvis, you have very large fields that include radiosensitive organs, so that's not the correct answer. In head and neck treatment, we're using extremely small margins that come in close proximity to several radiosensitive organs. There are very many in the head and neck area, and so immobilization is particularly important so that we can maintain these tight treatment margins and avoid all of these sensitive structures. I'm pretty surprised to be going over this one, but 48 said the SSN is also called the answer is jugular notch. Some of you put sternal angle, but B, jugular notch, was the correct answer. And question 50 asked, all the following must be kept in consideration during a head and neck simulation, except the correct answer was A, which said use ropes to get shoulders inferior and anterior. A is incorrect because we do not want the shoulders to be more anterior, which would put them further in the way of the treatment fields. We want the shoulders to be more posterior, which gets them further out of the way of the treatment fields. So question 50, the correct answer was A, which said use ropes to get shoulders inferior and anterior, making it the only option that was not true. If you would like to make reference to any of the questions that I just addressed, here they are. Feel free to pause the screen and take a look for yourself, review the answers, review the questions. It will help you to avoid making the same mistakes that you made on the final exam. I hope you found this review helpful, and I'll see you guys in just a few weeks.